send it down to the Daily Dodge TV studios with Terry Bell for today's community comment.
Thank you so much, Jake, and welcome everybody to another edition of Community Comment. Our guests today are from the Aging and Disability Resource Center of Dodge County. A lot of times getting older or living with a disability means some red tape, some confusing paperwork. Well, our friends here are here to help, not only at their office every day, but once a month here on 95.3 WBEV. We welcome Amanda Higgins, Jennie Farmer, and Ashley Sandler.
Good morning.
Morning.
Great to see you. If you have a question for any of our guests, please feel free to call 920-887-9595. You can also text that number. You can also call the WBEV studio line at 885-4446. And as always, we start with Jennie's joke of the month, and we have a bonus joke this month.
Yes, I'm gracing you guys with two jokes today.
All right.
So the first one is, what type of flowers do you plant in the dark?
What kind of flowers do you plant in the dark? Boy, I'm stumped. I'm thinking night works into this, but maybe I'm wrong.
Light bulbs.
All right, I should have known.
So yes, you were kind of on the same page when you were just saying in the dark. And
that was what the look was for earlier, Terry.
All right, I got a chance to redeem myself here.
Okay, and then my second one is, why did the farmer bury his money?
Why did the farmer, so his investment could grow?
Ooh.
To make his soil rich.
That's better.
Real close. Close.
That's a lot better.
Hope all the farmers out there listening like this, because I know a lot of them keep WBEV on their barns.
That's
right.
true. All right. Well, all right. On that note, it is springtime. May is right around the corner, and it's important to know that May is Older Americans Month.
Yes, so May is Older American Month, and the theme for 2026 is Champion Your Health. Well, and going with championing your health is to heart health, everything else with your health. And with the theme is underscore prevention, wellness, and personal responsibility as cornerstones of healthy aging. So it's really just paying attention to what's going on in your health, encouraging you to take an active role in managing and advocating for your health, assessing preventative care, and making informed decisions. So really this month, we really just want you to be paying attention to making sure you're just taking care of those things that you need to be taking care of. So we're just going to be advocating that you're just being aware of everything that needs to be going on in your older life.
Taking advantage of those Medicare preventative services. For those who have came to our class, we have a whole segment talking about just those preventative services and, just making sure that you're having a conversation with your doctor every year. Even if they're not talking to you about those preventative services, like Jennie said, you should be an advocate for yourself and bring some of them up and other questions that you have.
Right. And don't let anybody tell you that you're not feeling or sensing anything that you're certain that you are. I think that's a big part of advocating for yourself.
Right. Be your main advocate. I mean, you know yourself better than anyone else does.
For sure.
And that family history is really important. I've learned that just with my own self having conversations. Just if you don't know what your family health history is, do some research, ask some questions, because that might be more insightful for how you're going to approach if you come into that.
And if you have the Medicare and You booklet at home, many of you are mailed the 2026 Medicare and You book every year. If you go in that book, they talk to you about the preventative services, or the pages with all the apples on them. Then you can look at the preventative services that are free to you, as long as you're taking them, using those services at the time that it's appropriate to be using them, and your doctor agrees that it's appropriate for you to be having those services.
Where do you get a hold of a copy of that book?
Good question.
You can go on Medicare.gov and order a book.
Or you can call us, because we have plenty.
We have lots of them as well.
I feel so bad because I feel like I try to make sure that we have enough, talking about what we've used in previous years, but I feel like we always end up with a whole stack that we have to recycle. So if you need a copy, don't hesitate to ask.
Yes.
for sure. We're talking with Amanda Higgins, Jennie Farmer, and Ashley Sanborn of the Aging and Disability Resource Center of Dodge County. We need to take a quick break, but we'll be right back. You're listening to Community Comment on 95.3 WBEV, powered by Daily Dodge.
WBEV and the Daily Dodge TV studios, here's Terry Bell.
Thank you so much, Jake, and welcome back, everybody. This is Community Comment, and our guests today are from the Aging and Disability Resource Center of Dodge County, Ashley Sanborn, Jennie Farmer, and Amanda Higgins. If you have a question or a comment for any of our guests, please feel free to call us. You can call or text 920-887-9595, or you can call the WBEV studio line at 885-4446. The National Council on Aging is promoting something called Boost Your Budge Week. What's that all about?
Yes, so they had a Booster Budget Week. It was actually last week,
Oh, I
April
see that.
13th to
Yeah.
the 17th, but it's still worth us talking about now.
Oh, is it boost your budget?
Yes, that
it
was my fault.
Yes, we had a typo.
Sorry.
Yes. Yes.
Boost your budget week. That makes a lot more sense.
Yes, it does. So see what it's a good time to focus on what do you qualify for. Sometimes people qualify for programs that they don't even realize that they qualify for, and it's definitely worth a call to see what you qualify for. Whether it's for food share, whether it's for getting help with your prescription drug costs, whether it's getting help on your utilities. Cost of living keeps rising, and that's how they make a decision on whether or not you qualify for these programs. So whether you may not have qualified in 2026 for a program, but if your income stayed the same and the cost of living went up, you may qualify for those programs now. So you're living on a fixed income, and these budgets, these cost savings programs could make a huge difference on your program. So let's say you all of a sudden qualify for food share, and it might be $26 a month you get in food share. Well, sometimes that $26 can make a big difference in your lifestyle. You can get a free and confidential benefit checkup going on the National Council of Aging website. That helps with federal numbers. But you can also contact the Aging and Disability Resource Center and talk to a benefit specialist, one of us three, and we can look at what your finances are and see if you qualify for something that some of the programs we talked about before, such as the Medicare Savings Program, which will help make it so you don't have to pay your Part B premium anymore. We can see if you qualify for food share. We can see if you qualify for Medicaid. These are all programs that you may qualify for that you didn't realize you did. Last year, 190,000 people found an average of $4,500 in annual benefit savings. So there are programs out there that you might not even be aware of you qualify for.
And even if like you do qualify for food share, at least then you can kind of shuffle money around. I know that sometimes we have conversations and people just get kind of stuck in a rut a little bit because they want, either assistance from us, a direct monetary assistance to help pay for a certain thing, or, a benefit program that will pay just for housing. And sometimes that's not necessarily not something available to you, in a perfect world it would be, but sometimes you just kind of have to shift some cost around. So it might not be a direct assistance to whatever hardship, difficulty, whatever you're dealing with, but being able to qualify for some of these budgets to free up money in a different area to pay for that something, you just kind of have to put a Band-Aid on it sometimes.
Speaking of that, another tip would be to save your receipts. If you're paying for medications, even if they're a couple of dollars, save your receipts because you can add them up and submit them to get more food share, or it could help make you eligible for a benefit.
Yeah,
Good call.
Yeah, all kinds of strategies you can use to maximize your budget. That's fantastic. Also, we recently marked National Healthcare Decision Day.
Yes, so we did talk about this last month, but we just wanted to bring it up again. It was on April 16th. But just a reminder again to folks that it's really important to be planning your affairs. We talked about this in much more detail last month. We just wanted to bring it up again because it is timely that it was just April 16th. But just a reminder that, planning who you want to be in charge of your affairs if something were to happen to you. So do you have someone in mind that you would want to be POA of your finances? Do you have someone that you would want to be in charge of POA of healthcare for you? Do you have a living will prepared? Do you have these documents prepared and set aside so in case something does happen to you, you have a plan in place? Do you have your documents set aside where someone you trust knows where to find them?
That's a big thing, I think.
Right. So if all of a sudden you were in the hospital in a coma, do you have someone who knows how to take care of your mortgage for you? These are important things that someone needs to think about, and they're not fun to think about, but they're important details in order to make sure your life continue on and these important aspects are taken care of. If you're unsure of how to get started with these things, we do have a starter pack at our office at the ADRC that we can help you with to kind of get the ball rolling for you. Otherwise, you can also go on the Wisconsin Guardianship Support Center's website. That's guardianatguar.org. And they have POA documents that you can look at to do it on your own. But like I said, you can also contact the ADRC at 920-386-3500, and we have kind of a starter packet to help with that as well.
And it's so important to have those POAs, and I think it's also important to know that you have your healthcare POA, you have your financial POA. They can be the same person, but there are two different responsibilities. If you assign a job to one person, they're not necessarily taking on both.
Correct. Absolutely. And that's something that you really have to, I think, ponder yourself on who that person is going to be. The other thing I just wanted to throw out, though, just because a lot of times we're talking, about, as you age and get older in your lifespan, but honestly, doing that advanced care planning isn't just for older people. I mean, I think it's really important, people that have younger families, to establish some of this stuff. Maybe sit down and spend the money to maybe talk with an attorney, not only about these power of attorney documents, but to figure out if your family would benefit from a trust and a will. So there's just a lot of different levels and caveats. It's just not one and done.
Certainly. I know it's very important to know that you get your I's dotted and your T's crossed. Anecdotally, in my own family, I had a relative who thought they had taken care of everything, but then when they passed, and the relative who was the power of attorney ended up having to wade through a whole mess of things that were done incorrectly. And even though the relative who died, didn't leave behind much, it took like maybe a year or more of wrangling paperwork.
Especially if you have to go through probate, I'm guessing. Yeah, so I think that's where a lot of this planning comes into play, because if you have certain accounts set up and designated correctly with a beneficiary, you can avoid probate, and it's not so drawn out.
That would be.
Were you going to say something, Ashley? Oh, okay.
Yeah, for sure. Okay, moving along, we should talk about enhanced Medicare.gov's login. What's going on with that?
Yeah, so I know that we talked about this right before open enrollment, with Medicare adding a multi-factor authentication, just a second layer of security.
Sure.
In addition to your username and login, they had you connect an email address and a phone number, so you got that 6-digit code. Well, now they're enhancing it again. So anybody who has created a My Social Security account to either look at their Social Security benefits or applied for benefits through Social Security, Medicare is adding the same third-party login. So there's 3 options. We don't know exactly when this is going to.
It's already there.
It's already there?
Yeah.
Oh, okay. I haven't been in a little bit.
Yeah.
So apparently it's already there. So, and these are for brand new accounts, right? Ladies? Okay. So
It does appear, though, for all accounts. So when you go to log in, it looks like you have to do it for everyone.
Oh.
But there is a separate box for people who already have an existing.
Oh, okay. And so there's 3 different logins that you don't have to click all 3 of them. You just have to click one of them that you're going to log in through. So it's going to be the 2 that are connected with what Social Security uses, and it's login.gov or ID.me. It's just a way of verifying your identity. But there's a brand new 3rd one that we've never heard about. It's called Clear. CLEAR. So just something to be mindful of and aware when you're going into that account. So apparently, like we just talked about, all existing accounts can still use the same credentials. And really, it's supposed to be to improve the readability and design of some of the information that is in the account, and again, just to make it more secure.
And
Certainly.
people still can use even in non-existing accounts. brand new accounts can still use the Medicare.gov old login way to create a new account.
So
as
it's an
well.
option right now.
It still is an option as of right now.
Okay, so
And-
that might
yeah.
change.
Okay, that's
Right.
good to know. These extra steps may seem like a pain, but it's really for your own protection to make sure that your identity isn't stolen, and all kinds of bad things can happen then.
We're living in a crazy digital world.
We sure are. We need to take a quick break for the news. Speaking of crazy world, well, we will be right back. You're listening to Community Comment on 95.3 WBEV, powered by Daily Dodge.
Are you an
Daily Dodge TV studios with Terry Bell for more of today's community comment.
Thank you very much, Jake, and welcome back to Community Comment. Our guests today are from the Aging and Disability Resource Center of Dodge County. Getting older or living with disability often comes with some red tape and confusing paperwork and other challenges. Well, Ashley Sanborn, Jennie Farmer, and Amanda Higgins are here to help with that, not only out of the office in Juneau, but also over the air here on WBEV once a month. So take advantage of this opportunity. You can call or text with a question or a comment at 920-887-9595, or you can call the WBEV studio line at 885-4446. Housing insecurity is really, really hurting older folks.
Yeah, I mean, I don't think this is a new topic, but I think it's a topic to be had, just on how housing security really is impacting so many different areas, from affordability to availability to accessibility. And so we just wanted to, I guess, highlight and empathize a little bit with the struggles that are out in the community. There's a really good article that our program attorneys wrote that I thought was kind of enlightening to share. And in there, it just states that about 10% of housing units in the U.S. are move-in ready. So that means 90% of them are not move-in ready. And if you think about just general move-in ready items, but then you have to layer another component on top of that for just general accessibility, from roll-in showers to open space underneath the cabinets in the kitchen or bathroom for people who use maybe wheelchairs or some sort of mobility device. So we just wanted to take this opportunity just to talk about, planning for the future, just because this really goes hand in hand with some of the topics that Jennie talked about with financial planning and healthcare planning for end of life, all of that stuff. But I think, talking about some of those warning signs if you're not able to stay in your current living situation, to start that mental brainstorming of, not only cost and what is available, but also, is it going to fit your needs? And in having some of these conversations with either your loved one or even with yourself, by making like a pro and con list, I think it's going to help prevent a lot more negative outcomes on the back end. It still might not be ideal decision at the end of the day, but it's going to cause a lot more less emergency situations if you can start planning for that future outcome and where you really want to see yourself living.
Sounds to me like we're retrofitting houses to make them more accessible as we get older, or maybe moving into a place that's better suited for older folks.
Yeah, and even I mean, a lot of us want to, age in place, right? But some of that takes money. A lot of older houses have laundry in the basement still. So do you even have space on the first level to move that laundry?
My oldest son just bought a house that the only bathroom is upstairs.
Seriously, yeah.
There isn't even a first floor bathroom.
Yep.
So the older houses are really not built for people who are aging and or disabled.
Yeah, so in a lot of that stuff, if you are buying old houses or if you do live in an older house, bathrooms and kitchens, I mean, I'm not an expert in housing and renovation, but, owning a house, those are probably the two most expensive areas to remodel. So being able to start putting money aside, because even if you don't need a roll-in shower, maybe just for safety because of just your own mobility, it's going to be easier to have a walk-in shower so you don't have that lip that you're having to climb over. It is just going to be important to either renovate it yourself or look for some place that is available to fit your needs.
Okay.
So.
You are all benefit specialists. You're also counselors as well. And you wanted to talk a little bit about how people could get in touch with you if they feel that they need to.
Well, the three of us all work at the ADRC in Dodge County, which is housed in Juneau. But Amanda and Jennie do office hours as well. And they do accept walk-ins. You may have to wait if you walk in because if they have a scheduled appointment, their time might be taken up. But Amanda and Jennie do the Watertown Senior Center and the Beaver Dam Senior Center. Which days do you do of the month?
I believe it's the fourth Monday of the month from 2 to 4:30 at the Watertown Senior Center.
And I do the first Wednesday of the month at the Watermark here in Beaver Dam from 10 till noon. So we've been trying to make it more open where people can just walk in without an appointment just to get some general information from us. And depending on what the question or problem or whatever they run into, then we might just make it into a referral and then it would be assigned to one of the three of us. So even if, you're not over the age of 60, if you're younger and you have questions about disability or other benefits, please stop in to talk with us because even though we might not be physically to help you with the referral, we can still make it to loop Ashley in.
Yep.
Yeah, the three of us do virtually the same job. It's just a balance. The elder benefit specialist works a lot more with retirement and Medicare, and the disability benefit specialist side works a lot more with Social Security and Medicaid. So it's just kind of like a scale that tips, but we all do the same things. We help people connect to benefits that they're entitled to. So you can either reach us at the ADRC and get a referral to see one of us. You can call the front desk at 920-386-3580. You can email our
ADRC at co.dodge.wi.
Oh,
It
we
used
just
to
had
be-
a new email.
Yeah, it used to be HS Aging Unit, but now it's just
It is
ADRC.
ADRC, you're right.
Yep.
It is ADRC at co.dodge.wi.us. And that will go to our intake. They will then make a referral to us as well.
Yeah, it's terrific that you do those office hours because not everybody can just hop in the car and go to your office, especially if you don't have a car or a ride or if you live in assisted living. You're limited as to your mobility. So,
Yeah,
And
we really
if you feel limited with your mobility and the ability to get somewhere, still call
Yeah.
because there are things we can do. We have a transportation program at the county. Sometimes we have the availability to go out in the community. It really depends on our schedule. So don't hesitate to call because we all try to be flexible if it didn't meet people's needs.
Yeah, I was just going to say meet people where they're at.
Yeah.
If it's meeting at the library because you don't feel comfortable, coming to the office or meeting at your home, let's just sit down and have a conversation on what's going to work best for all of us to meet.
Yeah.
what can a benefit specialist do for a person?
Well, we can connect them to a lot of things. Did you have a list of things?
No, I was just going to look for something.
So a benefit specialist, we do everything from a benefit checkup to helping people apply for disability, apply for retirement, Social Security. It's
Food
really
share,
endless.
housing
It's really endless.
information.
If there's a public benefit, we can connect them to it.
If you feel that you're on long-term care benefits and you have some funding from your spouse that is not meeting your ability to pay for those expenses in the community, we can talk about, helping you with requesting more allocation or filing an appeal or a waiver. Even if we can't physically help you resolve the issues, usually we can talk about, like I said before, putting a Band-Aid on something. You might not be able to fix the issue totally, depending on what's available within the benefit rules or the law, but we try to at least minimize whatever the negative effect is.
Certainly. We are talking with our friends from the Aging and Disability Resource Center of Dodge County. We need to take one last quick break, but we'll be back. You're listening to Community Comment on 95.3 WBEV, powered by Daily Dodge.
Comment here on 95.3 WBEV. Here's Terry Bell.
So much, Jake, and welcome back to Community Comment. We're talking with Jennie Farmer, Ashley Sanborn, and Amanda Higgins from the Aging and Disability Resource Center of Dodge County. If you have a question or a comment for our guests, you can call us or text us at 920-887-9595, or you can call the WBEV studio line at 885-4446. Sounds like there are some new developments when it comes to Medicare outpatient observation notice.
Yeah, so the notice itself is not new. And just to give a little backstory, the Medicare outpatient observation notice, or for short, MOON, is something that you get giving you information if you are going to be listed as inpatient or outpatient for Medicare billing purposes. So, for the listeners that don't know real fast, for Medicare Part A, which is the hospital benefit of Medicare, for that to pay for your stay, you have to have 3 full days inpatient before Medicare Part A will cover you. Otherwise, if you're there for, let's just say, 20 hours and you're not coded as inpatient by one of the medical doctors, you'll still get coverage, but instead of Part A paying for that stay is going to be Medicare Part B. And then there's just going to be kind of a shift in the liability or the cost that would be billed to you depending on what other insurance that you have. So the notice has been around for quite a while, since like 2015. But there is an updated version that took effect April 21st, so just, last week or so. And it's supposed to be more reader-friendly. You're supposed to be able to understand your liability or your cost when you're in the hospital. However, there's some things in the new version that aren't going to be listed as clearly, such as if the person doesn't have that 3-day qualifying stay, it really doesn't go into detail about that. It also doesn't talk about if you are taking self-administered medication. So instead of having a medication administered to you through an IV or an injection and you're taking the medication yourself, that's called self-administered. Medicare Part A does not cover that, and you have to bill separately to your drug plan. So there's just some things that aren't very clear in the new notice, but it's supposed to be just overall more reader-friendly to understand, just what this notice is trying to tell you to begin with. So we just wanted to share that. You were supposed to be signing this new notice now. It should be given to you in writing, and it should be talked to you verbally of what it's telling you by the medical staff.
Is it still within 36 hours?
It's still within 36 hours that you're supposed to get this this observation notice if you are in observation status. So we just wanted to, give a little quick shout out on the radio, not trying to get too in depth, but anybody that has questions, we're more than happy to sit down and talk more individually about it. But just so you are a little bit more informed if you do get one of these in the hospital.
And this particular information we have highlighted in our newsletter as well. So if you're not aware, we have a quarterly newsletter that goes out to the ADRC.
Oh.
And we talked about this MOON, this notification, in our newsletter article, and we put a picture of what the actual notification looks like in the newsletter as well. So if you get our newsletter, you'll see what the notification looks like.
How do you get that newsletter? Is it in the mail? Is it by email?
We have a
All the
mailing
above.
list. Yep. And we have an emailing list, and our front desk staff are amazing and get that out to everyone on a regular basis, quarterly. And they have a running list, so if you would like to be added to the list, you just call the ADRC 920-386-3580 and just give them your details, and they'll put you on the list, and you'll get it each quarter.
I believe it's also on our website. I believe
think so, too. Yes.
When it goes out, I believe it's also can be found electronically on the Dodge County website.
All right. You also wanted to remind our listeners about programs that help lower Medicare costs.
Yeah, we just want to remind people that there are programs out there, Medicare savings programs. They are state-funded programs where the state is going to pay, if you qualify, the state is going to pay for your Part B premium. And there are 3 levels of Medicare savings program, and they're based off of your income and your assets. And so just to make sure that everyone understands, if you're in doubt, call and find out.
I like that.
And see if you qualify, because it's based off of, if you're married, it'll be based off of both incomes. If you're individual, it's just an individual income, but it can be a really helpful tool to save $202 a month, or if you have a penalty, it will help save that penalty too. So There's also the low income subsidy, which is really underutilized, but it's also called Extra Help. It's attached to prescription drugs. And if you are on Medicaid currently, you're automatically eligible for Extra Help. So you don't have to apply for it. But if you're a person who doesn't qualify for Medicaid but may have a lower income, there is the option to apply through Social Security. And it's a pretty simple application. It's not super long. And you fill it out and send it in, and Social Security will determine your eligibility for that. And then our golden nugget in Wisconsin. I wish it was available for
I do too.
for under 65, but senior care is a really, really wonderful tool for individuals that are 65 and older and need prescription drug coverage. So it's important that everyone has prescription drug coverage. So once you're on Medicare, if you don't take any prescription drugs, this is a really helpful placeholder, because if you don't have coverage, whether you take drugs or not, if you don't have coverage, you're going to get a penalty when it comes time to getting coverage. So it's really important for you to make sure that you're covered whether you take medications or not. And senior care is a really easy way to do it. It's broken out into tiers based off of your income. So it just depends on whether you would pay a deductible or not. So the higher your income, the more likely you'll have a deductible. But the generics are $5 and the brand names are $15. So it can be used also with a prescription drug plan. So if you take a prescription drug that is brand name, like Eliquis, is that a good one?
Yeah.
That one's really expensive from what I've seen.
Honestly, any diabetic medications too, because those
Yes.
are expensive.
So we put my grandma on senior care because of her Eliquis, and it lowered the cost, her monthly medication costs, enormously, because we couldn't find a plan that covered it well enough for her and her other meds. So we just kind of use senior care to cover that one. So it's a helpful tool out there
And
for
I
people.
always tell people to do a cost analysis between Part D and senior care, because you would be surprised which one might be able to save you the most money. So senior care, it's great, but it doesn't necessarily work for everybody depending on income. And then the other myth that I hear a lot is that people don't qualify for senior care, and that's not true, because
Everyone does.
everybody in Wisconsin qualifies for senior care.
Once they're 65.
Once they're 65, there's no asset limit, and you could have as much income as you want. It just depends on what that benefit looks like.
Okay. Just a minute or two left in the show. We wanted to let everybody know about some upcoming opportunities.
Okay, so to start off with, our Medicare class is the most thrilling class in the world. But we do really go through all of the nitty gritty of Medicare. And the next one is May 21st, and that'll be a 9 a.m. class at the Juneau Human Services Building. And then the June class is the 24th, and that is also morning class at 9 a.m. We do bounce the times around, but the next two are going to be morning classes. So come join us. If you're going to be starting Medicare anytime this year, you can get yourself ready to go beforehand. Next, the ADRC also has some other classes going on. The Stepping On is the name of the class. It's a falls prevention class that you need to sign up right away for, because it's going to start May 5th and goes through June 16th. It's going to be at oh goodness, SSM Health Physicians Offices here in Beaver Dam. It doesn't have a cost. There is a suggested $10 donation. If you're interested in falls prevention, call the ADRC at 920-386-3580 and sign up for that class. Registration is required.
I just made a note. The ideal number of people for that class is like 10 to 14, and we have 6 signed up. And the only reason why I'm saying that is because I'm one of the facilitators.
Oh, are
and
you?
it just makes the class a little bit more conversational if we have more that are signed up. So if you are at all interested or know someone who might be interested, please send them our way.
Do you have a minimum that you have to have for that class?
I believe it's 8.
Okay.
So
So
we're
we're
still
still
looking for
working
a
on
few.
it. Okay. So our other events, we have a May gathering event at the Horicon Wildlife Center to take a walk around the marsh. That is going to be May 28th from 11 to 1. You can RSVP by calling Candace at at the ADRC at 920-386-3580. Please RSVP by May 1st, or May 21st, sorry. Candy also has another fun event at Cowlicks on June 25th. It's going to be a caregiver event. So if you're a caregiver, come meet Candace at this event and have some yummy ice cream too. It is the 25th from 1:30 to 3:30 at Cowlicks, downtown Beaver Dam.
In June.
Did I say June?
I don't know if you say the
June
month.
25th.
Okay.
She's been really great about having monthly events.
Yes.
So if you aren't connected to WBEV, just know that she's been pretty adamant about monthly stuff. So if you miss the May, come to the future ones.
Fantastic.
Yeah.
Well, we are out of time. It's been great to have Amanda Higgins, Ashley Sanborn, and Jennie Farmer with us on Community Comment. We want to thank you for joining us. You've been listening to 95.3 WBEV, powered
you.
by Daily Dodge.
Thank you.
Thanks, Terry.